Okay, we're trying to link up with a let's see, there we go. If we can get this linked up so um, the audio can be heard from there. I'm gonna bring them in a second here, and hopefully that's working, and we'll see what it looks like.
Want to leave the mic so that one person can speak at a time, because right now we can hear everyone, and I don't know if that's what we want to do.
Okay, we're trying to do a restream here of the conference they're having from Whatcom County Health. I'm going to bring up their video in a second here, and hopefully the sound will go out with no problem. We're still waiting for them to bring up sound from the conference.
I'm not seeing Erica. Is Erica here yet?
It doesn't look like she's joined yet.
Okay, so we'll give her a few minutes before we get started.
All right.
Okay, we're trying to do a test restreaming on YouTube of the Whatcom County Health Department. This is to set up a committee on how to reestablish regular business in Whatcom County, and hopefully we'll find out how things go here. This is a test from Point Roberts TV.
Getting lined up for the meeting. Who is in charge?
I am waiting for Erica to arrive. So I wanted to just give her a couple more minutes if I know we're all short of time and it's already 3:30. We'll just give Erica a couple more minutes. I don't see Tammy. Is Tammy, are you here at the meeting?
I'm right here.
Okay, great. And you're
welcome.
taking notes, right?
I'm taking notes. And if you want to, before Erica gets here, we could do a roll call of PHAB members to see if we have a quorum.
Yeah, let's go ahead and do that. And then as soon as Erica gets here, I want to make sure that everybody has a chance to say hi here. Okay, so I'm going to my name's Chena Stone, and I'm the chair for the PHAB, and I want to just take a roll call so that we can make sure that we have a quorum. And is Steve Bennett here?
Here.
How about Barry? Barry, are you here yet?
Here.
Okay, perfect. Sterling, are you here, Sterling?
Here.
Okay, perfect. And Sterling, by the way, is the vice chair. Barbara Juarez. Barbara, are you here today? Okay. Lindsay. Lindsay Karras. Okay, perfect. Lee Seeley.
Les.
Is he here?
Yeah.
Okay,
Yes, I'm here.
perfect. Okay, awesome. Leah, our newest member. Leah, are you here? Leah Weinman? Okay. So we have 1, 2, 3, 4, 5, 6. So we have 6 members present, so we have quorum. So the first thing that I want to just tell everyone, number one, thank you for coming. And secondly, let's just mute everyone's phone except when you want to speak, just so that it cuts down on the background noise so we can actually hear each other. I just got to notice, can we get spellings of people's names? I actually don't know how to do that. Tammy, do you know how to do that? If you can type in the answer how we can do that, that would be fantastic. But the meetings that I've been, I don't actually know how to get people's spelling on the screen as we're watching. And we might be able to get the names out when we get the minute from Tammy, so that everybody knows at least kind of what the everybody's little squares are standing for. So the first thing is welcome, and secondly, let's mute our mics unless you are speaking. It cuts down on the voice, on the background noise, and also we don't have too many people talking at the same time, so we can actually hear each other talk. So at this point, I wanted to introduce Laura as our facilitator. Laura, are you here?
I am. Hello, everyone.
Okay, hi, Laura. Welcome.
Hi.
Thank you so much for coming. And since I still don't see Erica, I am going to say,
I'm here.
oh, hi, Erica. And everybody. Oh, hi, there you are. Hi, Erica. So Erica is our, I want to say returning, but our new executive director for the health department. And she's just like, since she started, she just jumped into the fire of COVID-19. And I just want to give her a big applause. She's been like just awesome. But anyway, so, and I think she probably knows more people than I do. She's actually was here before she took sort of kind of like leave of absence, and then she came back. But anyway, Erica, I was just at a point of introducing Laura as our facilitator today. So do you want to take over at this point? Erica?
Do you want to take over, Laura? You want me to
Sure.
take over?
Okay, awesome.
Erica, do you want to say anything at the beginning of the meeting? Because we're going to jump right in.
No, you just jump right in, Laura.
Okay, great. Welcome, everybody. It's nice to see and meet some of you. We have a lot of people on this call. There's 81 people, I can tell right now, 82. We are focusing on the advisory board task force for business support today. And the first part of our meeting is the discussion and establishment of this, along with the documents that Erica shared with the advisory board. So at this point, she's going to share with us framework and vision and perspective. And right there.
Thank you, Laura. So you've seen some documents over the weekend. I appreciate your input and feedback and your interest in this task force.
This conference will now be recorded.
Oh, thank you, Tammy, for recording this so those that aren't present can listen in later. So the health department, in partnership with Whatcom Unified Command, realized, and we have known for a while, that when we are going to reopen businesses, especially small businesses that don't have internal supports like an HR department or safety officers, that it would be very helpful for businesses to receive some technical assistance and support in order to take measures for infection control and social distancing so they can keep their employees and their customers safe upon reopening. And the Whatcom Unified Strategic Planning Unit, and I believe Steve Hollenhurst, who's from Western Washington, he's the dean at Huxley, but he's on loan to Whatcom Unified for a few weeks here. He and I and Laura have been talking about the structure by which this task force may be developed. Steve, are you here as well? I'm sure he'll be joining us.
Yeah, I'm here.
Oh, great. Hi, Steve. So we've been working on kind of a framework, but this is really an opportunity to get to a place where the Public Health Advisory Board feels comfortable with the direction and it feels good about moving forward with the process. My vision for this work is, and I don't want to oversimplify it, and I don't want to make it seem as though it's a one size fits all, because it's not. But my vision for it, in sort of simplistic terms, is that the Public Health Advisory Board Task Force is able to create, in partnership with various sectors, create sort of I would say, cookbook. And within the cookbook is different recipes. And these aren't like baking recipes where you have to follow every bit of instruction to a T or it doesn't work. But there are recipes for each sector. So the idea is that each sector is able to weigh in, contribute, understand what the guidelines and regulations are, and the recommendations from the health department about how to do infection control work well in different settings, and also how to ensure that social distancing measures can be put into place. And these are going to vary based on the sector. There'll be different recipes, and there will be opportunities for each business to weigh in, to adjust, to discuss the regulatory and physical barriers or staffing barriers to being able to implement these. And at the end of the day, there's some guidance for each of these sectors to be able to implement, and when they reopen, to be able to feel confident that they can keep their customers and staff safe. So that's kind of the vision for the work. And I kind of want to talk through the process. And I know, Laura, you have some questions for the group as well. So if you wouldn't mind, I'll just turn it back to you at this time.
Yeah, great. The work today for the advisory board is to put up this task force and to approve of it. So those of you that had a chance to read through the purpose statement and the vision of it and what Erica just offered, if this is the way that we're going in a partnership, collaboratively as a community, from your perspective, I'm speaking specifically to the advisory board right now, what would success look like for you? What would we accomplish by doing this for our community? And what could we see as the outcome in a successful way?
I'll go first. I absolutely want to see our community get back to work. At the same time, I think we have to hold lives in our community just as important. And unfortunately, this virus that we're dealing with, there's much unknown. We don't actually know. There's so much unknown that I think, just like what Erica has said earlier, it's, you know, whatever recommendations that we come up with, it can't just be, you know, step by step, this is what we do. I mean, we have to have a lot of room for flexibility, but we have to honor what is coming out in our scientific medical platform while we're listening to what our businesses and our community need, while keeping the employees safe as well as the customers, the community at large. So when we are discussing this, you know, we have to have a lot of conversation, but whatever we come up at the end, I want to make sure that we honor both sides to keep everyone safe.
Thank you. Other insights and input from the advisory board around what a successful?
This is Sterling. I know the state is going to provide the overall timeline and guidance, and it's clearly up to the local county, at the county level, to kind of make people work. So I'm glad that we're involved in getting that ready, so that we're ready to go when the state says we can go. I can jump in real quick if no one else is talking. Yeah, I think just to add on to what's been said before, I think two things a few things are really important. First is to make sure that we look at this, just to use the wording that was used before, that we look at this cookbook as a living document, and not have it be something that we set out and be like, well, there it is, and then just kind of walk away from it. As the situation changes, we need to be able to adapt what the quote unquote recipes are. And then I think another thing that's really important to take and to communicate through this process and communicate within the cookbook, as well as with various sectors, is risk. What risk is in various sectors, what risk perception is, and the importance of communication and people understanding risk around certain behaviors or within certain industries or through certain activities, how risk mitigation can work, but also how risk mitigation isn't 100%.
Thank you.
I have Les Seeley here, PHAB member. I have a comment. Success for me would be limiting the loss of life and open in a way that we do not have to step back to lock down again. If businesses have to lock back down and send employees home again, that will not be survivable for businesses. So a slower approach, a more guided approach, and we don't have a playbook for this. We'd have to do it right the first time, and there's no playbook. So as slow as possible is the best way to go. As tested as possible. Thank you.
Thank you. Any other advisory board? Yeah. Comment?
I just have one more, and that is, after we come up with all of this, is that me? Why do we have? Okay. I think we need to have buy-in from our greater community. So whatever recommendations that we come up with, we need to make sure that we communicate to greater community, that people are at large, so that everyone has a buy-in, everyone has skin in the game, and we all do this together. So, you know, we cannot leave out our community. We need to make sure that we have the communication really strong, intact, and constant. You know, letting people know what is happening, you know, what we're thinking, and listening to what people have to say to us. So I just want to make sure that we have the communication piece in there.
Great, thank you.
I was remiss in not including that part. That is one of the two key elements of this plan. It's really, you know, the PHAB and health department could write these regulations in a vacuum and send them on to everyone and say, you should do this. But true buy-in is the only way for this to be sustainable, because the health department and PHAB do not regulate most of these businesses. And in order to ensure that people feel not only, well, I should do this or I have to do this, but I want to do this. It's important, and it's the way that I can keep trust with my staff, and it's a way I can keep trust with my customers by doing these measures and by being involved and making sure that this is a collaborative process. So absolutely, I couldn't agree more. This has to be a partnership. There has to be buy-in from everyone for it to be successful.
We had a long flat peak.
Great.
Can I just remind people to mute their mics, because we can hear background noise.
Rest of the country.
I think I see Greg raising his hand.
Yeah, great.
I want to say though, we have had outbreaks. We had outbreaks
So,
in specific.
what is that background? Anyway,
maybe the organizer could turn off everybody's mic. That would help.
okay, I think I'm open now. Steve, I wanted to emphasize what you said about this cookbook being a living document. And I'm thinking of our experience in working with some of the long-term care facilities. There's plenty of recommendations and regulations out there already. The big challenge is for business owners and organizations to figure out, how do we sustain our work in a way that's safe for ourselves and our customers and our staff? How do we keep these levels of virus transmission down that allows us to sustain our economy? It's not even an issue of economic recovery. It's not going back. This is going to be a long haul. So we need to be doing problem solving that deals with sustaining virus suppression and all the advances we've made that with all the measures that have been taken so far, while having a sustainable economy in the time during a COVID pandemic. So we're trying to find that balance, and I would think success would be both a compendium of solutions to these problems, but also a relationship. So should the health department or the community be able to provide technical assistance where we have dialogue with businesses, with organizations? We say, what is it about your situation that you can improve the infection control while still doing business? Or what are the barriers to being able to take those measures? And do we have resources as a community to help you take those measures? Are there things we can do together? So I would like to see come out of this, not just the book, but the process and the relationships that says, we've got this problem on the table. Your business, your sector is part of the community. How do we work together to minimize damage from both the virus and from the economic effects of controlling it? So that's my framework, and I think, and that ongoing process will be an important outcome, I would think, of the task force. When you're being charged to come up with a plan, the plan isn't the regulations. The plan is how do we sustain this process over time.
Thanks, Greg. I think at this point, it'd be great, Erica, to hear from you about what you envision the process to be. And then I think we need to take a vote with the advisory board.
So here's what I'm thinking process-wise, and I'm curious about your thoughts on this. This could be very complicated, and it could be quite a behemoth. And both of those things are okay, but we also are on a tight timeline. So kind of thinking about how to maximize efficiencies along the way and share the work and make sure we're kind of doing all of these in this timeline. So my hope for the process is we have an agreement about moving forward for today. We establish a task force based on what you've talked about with regard to what success looks like. I build this framework out a bit more by the end of the weekend and send it to you for review. I want to be clear about what sectors we want to include in the task force versus what sectors we engage with. And then mid next week or early next week, we put out a notice for applications for the task force. And I just want to be clear that the task force is one element of this, but I don't see that if someone is not on the task force, they're not included, because all the sectors that we want to engage are included in the process, and all individuals that represent those sectors or own a business in that sector can participate in this process. But if we can get some agreements about the number of representatives from different sectors on the task force, we can get applications going. I would ask that a small group of PHAB members get together sometime mid to late next week and review the applications, and then the PHAB meets next week to vote on the membership, maybe next Thursday or Friday, to vote on the membership of the task force. So those seem to be, in terms of process, kind of the next steps. So really using your feedback from this meeting to flesh out that framework a bit more, figuring out the membership, and then voting on the membership so we can move forward as a team.
Can I ask a question?
Please.
Okay, my name is Michelle DeKukuk. I'm with Weichert Realtors, and I'm not sure what this task force is for. I'm wondering if you guys, what do you think about businesses putting together for their business the things that they're willing to do, like, you know, the different things to, for example, you know, have one person in the office at a time, or the different ideas that they're going to use for their business in order to make this be good, and then they submit it to the task force, I'm guessing, and then you say, yes, you can open or you can't, or what is this for?
So we're not the authority that can authorize businesses to open. The governor will make initial decisions about that on or around May 4th. What we're trying to do, not as regulators, but as partners, is work with different sectors to provide best practices and guidance about what we know from public health science, and then work within those best practices and guidance to customize that work for different sectors. So you mentioned one person in the office at a time. That may very well work for a realty company, but it may not work for other business. So it's really tailoring the guidance in partnership with different sectors and coming up with some solutions collaboratively. But this will not be the body that makes a decision about which businesses can open and which ones must stay closed. Thank you for that clarification. I think that's really important.
One of the great things that you offered, Michelle, earlier, I want to enforce, is that we really hope that this is a generative, collaborative, successful sectors working together, supporting each other. High tide raises all boats. How do we get people working, again, safely together? So if your best practices in your office can be shared with somebody else and they can learn something from you, that is a big win of what we're trying to accomplish here. The buy-in, the generosity, the generative work, of supporting our living community. So thank you for that.
So I guess what I'm kind of hearing you guys say is this body, this task force should come up with this kind of like a recommendation, body of recommendation, so that businesses can take that and they can tailor it to what they need in order to make the business safe for the employees, the clients, the customers, the environment, so that we don't go back to having to sequester again, so that businesses don't have to shut down and let go of employees again. So if the businesses have the guidelines first, then they know kind of what to shoot for. So there's kind of like a structure that people can follow, instead of, oh, I think this is what we need to do with, I mean, I'm sure, everybody's been following this, so everybody is very well informed, but we can actually offer structure so that people can have something to have a standard against. Am I correct in that understanding as to our job for the task force?
Yeah, I think that's accurate, but also informed by their own experiences, their own barriers, and their own sort of unique nature of their sector.
Yeah, I think one of the things that I wanted to just kind of reiterate based off of what people were saying here, and to kind of bring back a word that Greg tossed out earlier that I think is important, which is sustainability and sustainable, which is the idea that with businesses reopening, I know that some people have this urge to return back to normal. But I think that one thing that will be really helpful to come out of this is helping to work with businesses to define what the new normal is going to be. That there's not necessarily going to be this reverting back to what we always did and everything's going to look exactly the same, but that this is finding out a new sustainable path for businesses to engage economically again and prosper again in some manner.
I also think the task force is supposed to listen to some of the sectors. There's a lot of good ideas about how to go about that, and one of the things a task force can do is to collect that. We're not the ones who are going to design the best practices. We'll hear about the best practices and understand how to go about this, and then buying in and following through with it. So part of that will require that we be good listeners too.
Greg, yes.
Yeah, just one other thought. We're talking about the task force coming up with the recommendations themselves, and I want to also bring out that possibility of setting up the resources to be able to have this kind of dialogue. We're talking about, there's a lot of talk right now about the importance of testing, more testing in order to find cases so that you could isolate and quarantine. It stops suppression, and we're talking about thousands of more people on the ground doing that work. There's also the thought of having technical assistance so that we've got a lot of people that can have dialogues with business owners and organizations. So is there a process for not just applying the recommendations and applying the regulations, but really looking together and identifying what are the barriers to implementing those practices? What are the practices that you could implement that would also reduce the risk of spread? It's not going to eliminate the risk, but everything we do to slow the risk means we've got fewer people getting sick in our community. We're not going to have, we won't have to dial up the restrictions again to bring the numbers down if we can keep them down by doing the things that have worked so far to get us in the position we're at now. So would the task force recommend a more enhanced work group, technical assistance process to work with folks, not just about regulating them, but doing problem solving together? individually on site? What are the things you can do at your place of work to kind of do these best practices or come up with other things that may have the same effect of reducing spread?
Thank you, Greg, for that. I think, we'll identify a few more ways that the task force will be utilized for sure. I appreciate that insight. Erica, do you want to say something? Then Vince has his hand up, and then I think we need to come to a vote here pretty soon. So,
Greg and I have had some really good conversations about this task force, and we've talked about sort of this continuum, which is yet to be known, right? But from a medical perspective, this, from low acuity to high acuity, there may be some low acuity would mean that a business just needs the document and they're ready to go. They can implement, they can see exactly how their business model aligns with some of the best practices and guidance. And then there may be a business on the high acuity end that says, we would need to change everything about our business. We would need to change the physical layout of our business. We would need to change all sorts of different things. We need money and we need resources and we need people on site to help us walk through this and think through this. So there could emerge an entire continuum of different needs and technical assistance needs. And I think that will be sort of, as we go, we will learn what that looks like and how we can provide assistance. I think there's an opportunity to leverage community resources and community dollars to bring certain sectors up to where they can feel confident, but that's sort of yet to be known. And I really appreciate you mentioning that, Greg, because again, this is a partnership and we'll learn what that looks like and what that means to different sectors.
Vince.
It's okay. Can everybody hear me? Am I correct in thinking that we need to take a vote among the PHAB members to see if this gets approved?
This is Tammy. So the first thing to do is to have one of the PHAB board members make a motion.
I guess that's what I'm thinking. So should I at this point ask for a motion to form the task force?
I make the motion that we vote task force.
Okay, great. Could I get a second?
I second the motion.
Okay, awesome. Is there any further discussions or make any recommendations to change the motion? No. Okay, then I'm going to call on each one of us who are here to for validation of vote. Okay, so Steve, how do you vote?
Yes.
Steve, is a yay?
Yay.
Okay, Barry.
Aye.
Awesome. Sterling.
Yes.
Okay, Lindsay. Lindsay? Okay, we'll come back to Lindsay. Les?
Yes.
Okay, awesome. And I say aye also. Lindsay, I feel like we lost Lindsay. I see her LC, but I don't know if. So there were 6 of us and we still have a 5 vote of yay. So the motion passes.
Lindsay just wrote in.
Okay, she wrote in yay. Okay, awesome.
I believe Barbara Juarez is here as well. I just saw her down the screen.
Oh, okay. Barbara, are you here?
Yes, yay.
Yay. Thank you. Thank you for coming. Oh, I see you. So we're just taking a vote, Barbara, for forming the task force for the COVID business support. How do you want to vote?
Aye.
Okay, awesome. So let the record show that it has been passed unanimously.
Great.
And so the next part is the planning discussion, people that we would need. So I'm gonna toss that back up to you, Erica or Laura.
Yeah, I think either one of us could field that. I think we're looking for 2 or 3 advisory board members to join the thought partnership in the next 5 to 7 days to identify the sector.
I can do that. This is Sterling.
Thanks, Sterling.
I'll
I'm
do
happy
that.
to
as
join.
well. Well, awesome. There's 3 of us already.
Okay, I could too. I'm last of the table, but I could do it too.
So we have Les and Sterling
Steve.
and Steve. Okay, great.
And Gina.
And Gina. Okay, that's probably enough, I think, for that part. Yeah.
Tammy, what would constitute a quorum for the group?
5. The 4 is fine.
Okay.
Gina, is there anything else that you wanted to say about in this period of time? Because I wanted to get back to Vince, wanted to make sure that we got his comments, and then I have a few other things to get asked.
I think that's it. I just the next thing on my list is to invite any public comments. But you can go right ahead, Laura.
Okay. Before we get to the open public comments, Vince, did you have something you wanted to offer for this group in this thinking process?
Hi, how's it going? Mine would probably be an open public comment. So
okay,
go ahead.
Okay. I think, Erica, is there anything else you want to offer about the task force or where we are in the process? I think there is the ask of the advisory board that we have a meeting next Thursday or Friday, and Tammy will coordinate times with everybody to approve membership.
Yes, and prior to that, Sterling, Les, Steve, Gina, and I, along with Laura, and if you're open, I'd like to continue to include Steve Pollinghorst from Whatcom Unified Command, who's been working with me on this to form the structure by which we appoint and create an application process for task force members.
Okay, great. I think at this point we are in the public comment section. So I'll turn it back over to you, Gina, to lead that section for us.
Okay, so we are open for public comments. So we have a lot of people, 70 people left. We started out with, I think, 90 somewhat people. So you can raise your hand to let me know that you want to speak. Okay, go ahead. One with the gray gloves. Go ahead.
Hi, my name's Vince, and I own the Mount Bakery and the Temple Bar. From the can everybody hear me? Yeah, okay. From the restaurant perspective, or at least from my restaurant perspective, my hope is that the task force will not be just seen as having a single direction of getting open again, but really following whatever we're seeing in terms of the feedback from the government and from the testing, so that if we do get whatever the task force puts together, it's about opening or slowing down as needed if the virus gets bad again in the fall or in the summer or something like that. There's a lot I'd really like to see that as an industry we have a nice base set of rules so that everybody's kind of on the same page and one person's not throwing the doors open while the next person doesn't feel it's safe or whatever. That was my comment.
Thank you for that. Go ahead.
So my name is Michelle DeCucuc again, and I'm wondering how many people are you wanting on this task force, and are you wanting people on here from all different sectors, or what is your thought on that?
I actually do not know. So I'm going to ask Erica or Laura. What are your thoughts on those?
Well, from my perspective, and I said this before, I think this group should be as large as it needs to be in order to ensure we have good sector representation. And I don't have a magic number in mind, but we want to make sure that that sectors feel represented and they're able to weigh in as ambassadors for their sector. So we'll know more about that within the next probably week or so.
Okay, and where would you get an application to become one?
Me along with the other members of PHAB will be working on that next week, and so we'll have the application out. And like Erica was saying earlier, even if you are not on the task force, you are still invited to participate because we want to hear your concerns, your wisdom, your experiences, your fears. And so whether you get to be quote unquote picked to be on the task force or not, please don't feel like you're being excluded or your voice is not being heard. We want to hear from you one way or another. So, let's keep that line of communication open. I saw Gray Shirt. Yes, go ahead.
Hi, thank you. It's Robert Mittendorf with the Bellingham Herald. I just want to be clear that you voted to form a task force and now you're discussing about how to start an application process. And then it sounds like you're saying that these meetings will also be open to the public in the way that this one is now?
Yes, today we are agreeing to form the task force today. And next week we will be working on the details of how to form that task force, through the membership and the application process. And when the task force meetings will be taken, it will be open. So it will public will be able to attend.
Okay, and thank you very much. And you are China?
Yes, I'm the chair for PHAB.
And could I ask also, since these meetings have high public interest, we'll be covering this, and I've seen some other members of the media here. We don't know all of you. I have the spellings of some of your names from the Public Health Advisory Board webpage, but there's some people who have come up whose names aren't on that list. Could we have people say their names and what their affiliation is when they speak?
Would you like that for everyone, or would you like that only for the PHAB members?
I think it would be good for everyone, especially if this is going to be recorded, so we know who's talking.
Okay. Is that okay, Tammy?
Or if you have a different way of identifying people.
Yes.
Go ahead.
So I was just going to say that should work. I have been capturing each name as they've done the public comment. And there were 2 questions during the meeting, and I did capture the names there as well.
Great.
Axlin, I'm the office coordinator at the Whatcom County Health Department.
Okay, great. Thank you very much.
Mm-hmm.
She probably might be the one that you want to talk to, get in touch with for the spellings of the names and, just more of the specifics.
Great, Tammy. I can find your email.
Are there anybody else with concerns, wisdom, experience, fears that you guys want to share that we as going forward with this task force want to let us be aware? Okay, I just got a question. Will there be a sector representing children's activities, sports, etc.? I'm not sure if we have a specific sector for children's activities, but I do know that our vice chair, Sterling, is definitely all about children and children's health and mental health.
I think some of the sector stuff is going to be decided over the course of the next week.
Absolutely. So thank you.
So we don't necessarily have those answers yet.
Yeah, thank you for reminding us. Another question I have is what skill set are we looking for? I'm just going to say a quick blur because, you know, I think Erica and Laura are probably much more apt to answer that question. But I don't think we're looking for any particular degrees or, you know, what we're looking for are people who have, you know, interest, their skin in the game in the businesses they own, places they work at. So really, if, you know, as long as you want to talk to us and give us your ideas, that's what that's what I'm looking for. But I'll hand it over to Erica and Laura. Maybe they can be a little more specific if there are specific skill sets.
No, I think you're right on, Sheena. This is really about experiences and the ability to weigh in on the process and have knowledge of certain sectors. But again, I just want to reiterate that these decisions about the different sectors, the application process, and the membership have not yet been decided. But these are helpful considerations for us.
Okay, so another question I have.
I have a.
Go ahead.
Where they're coming from?
Please go ahead.
Listen, now we're not. Okay, I have a very, very quick, simple question. I might have missed this, but is in this all this planning, how is the idea of testing fitting into it? If it is, or if it's not, or did I miss that?
We have not gotten into any specifics of how it's going to work. Testing is definitely absolutely important. And thank you for bringing that up.
Could you state your name, please?
My name is Joy Siegel. And I only ask that because every single medical official I've seen in the last 60 days has said that when you're coming out of this, testing has to be an integral part of it. And I don't recall hearing anything about it today so far, so that's the only reason I'm asking.
So unless Greg wants to answer this, I can take a stab. This is one of a number of strategies that the health department is employing to address COVID. But I hear Greg talking, so go ahead, Greg.
So I kind of mentioned it in passing earlier. One component of being able to sustain the suppression of transmission is testing more people. So for the purpose of finding folks that are infected, so we can identify their contacts and they could be isolated and quarantined. So that is case finding, and testing is necessary for that. The thing is that we've gotten to this point primarily by not what we're calling non-pharmaceutical interventions. The hand washing, the physical distancing, and all the way up to the business closures. And we're trying to figure out how do we sustain that suppression of transmission without not just the testing, isolation, quarantine. There's other things that have been really successful. What are the things we can do more of in that range that will keep us able to keep the doors open and the business is going? So there are two aspects of the same goal of stopping. That's really the first step in isolation quarantine. And we've got a dozen other measures that we can use to stop suppression. To stop transmission of the virus. So it's all part of one thing, but this is really focusing on what can we do in our businesses and organizations and community what sort of behavioral changes, engineering changes, administrative changes can we keep can we use to stop the spread of virus?
Could I ask a question?
Yes, can you state your name, please?
Yeah, this is Mike Kent. I'm on the call-in. That's why I'm not on the screen, I believe. In selecting or reaching out for members of the task force, would it not be maybe more efficient? Because time's against us. We've lost 1,000 jobs in Whatcom County just today between Intalco and now the airline interior manufacturer. So time's of the essence. Would it not be more efficient rather than look for individuals to join the task force, but to reach out to association heads, people like in our case, we have 800 members in the Realtor Association, to get a hold of, say, our executive officer and have him represent us. And in turn, we can have subcommittees to put forth our ideas. And you're going to reach a much broader base. The building industry could bring the BIA president. And I'm sure just about everyone on this call is a member of some type of trade association, where on the local level, they could have a representative where you'd represent far more people and let us do the groundwork of getting the discussion so it doesn't bog you folks down with every individual person who wants to participate from a particular industry. Just a comment. And also, a lot of these industries, ours included, we have already established guidelines through the governor's office that could be duplicated in many industries that parallel our mode of operation. Thank you.
Thank you.
Thank you for that input.
You're welcome.
So what's
there's-
next?
Well,
ahead,
there's a
Jamie.
couple other questions, and I know we only have 5 minutes, and I'm gonna just try and get through just kind of the easier ones. Where would we find the recording of the meeting? Tammy, will it be on the Whatcom County Health Department website? Tammy, can you enlighten everyone where they can find the recording?
Yes, we will post the recording both on the Whatcom County Health Department website and on the county website under the Public Health Advisory Board, attached to where the agendas are found.
Okay, and there were a couple of other questions, and I think one that the task force goal is to educate. The task force goal is to hear from the community, hear from the business leaders, and come up with a set of recommendations and to create a communication line with not just the business, but the community at large. And I hope that kind of answers that question. And the other one is about the escalation of wanting desire for PPE equipment more than what is recommended. I think we can dive into that a little bit more when we are actually meeting as task force. What do you think, Erica?
Yes, I agree.
Okay. Are there any other comments, questions, things that you guys like to share before we kind of come to closing the meeting?
I have a quick question. So right now, we're obviously all in on this conversation or this meeting. Now, after the task force meets, I'm assuming we're gonna have more of these meetings, and then how will we know about them so we could join them?
Tammy, can you answer to that?
And Tammy, can you also provide the email address so folks can send questions or comments following this meeting or after they've watched the recording?
Sure, I will put the email address in the comments, the chat box. And meetings will be published on the county website. There's a section for agendas. You can subscribe to receive notifications of meetings at that site, and you would get an email notification anytime that we're having a meeting. It's probably the easiest way. But you can email questions to us at the health department, and I would answer. If you're having trouble finding it, I'll answer any of those questions.
Thanks.
Okay, Erica, Laura, anything else? Greg, anything else? Okay, so I just want to thank everyone for coming today. I know everyone's lives are crazy and different and busy, but I just want everyone to know we want you guys to be here. We want to hear from you. We want to hear your voices, your concerns, and we couldn't, carry on to forming our next steps without you guys being our partners. And so I just want to say sincere from the deepest from my heart, thank you for coming. And I'm going to adjourn the meeting 2 minutes early.
Thank you, Gina.
Okay, thanks.
Thank you.
Okay, so that's the end of the meeting from Whatcom County Health Department forming a committee so they can establish best practices for businesses as they're able to open up again from hopefully we'll be able to correct those in the future meetings. This was a test to see if we could do it. It looked very successful. Hopefully we'll be able to do it in the future. From Point Roberts TV, bye for now.